I am Dr. Natalie Harmon. For over 20 years I have been working in the fields of neurology and emergency medicine, standing beside stroke patients every single day. During this time I have had to deliver both hopeful and devastating news to thousands of families. And I can tell you this clearly, the difference between surviving a stroke and suffering permanent damage is most often determined not by what happens at the hospital but by what happens in those critical minutes before the ambulance arrives. This video exists for exactly that reason. Today I am going to share with you a technique that is often thought to be known only by doctors but that anyone can learn. A scientifically supported method that requires no equipment whatsoever and can help protect your brain from the moment stroke symptoms begin until help reaches your door. Stay until the end. Because this knowledge could one day save your life or the life of someone you love. Why is a stroke so dangerous? First, we need to understand the fundamental reality. The brain is the organ most dependent on oxygen in the entire body. When the heart stops, the body can survive for a few minutes. But when blood flow to the brain is cut off, damage begins within seconds. Every minute of delay equals approximately 1.9 million brain cells lost. Read that again. 1.9 million cells per minute. This is why the most important phrase we use in hospitals is, "Time is brain." And here is what most people do not know. In those critical first minutes, the right body position and the right breathing pattern can help preserve blood flow to the brain. It does not stop the damage entirely, but it can slow it down. And in stroke medicine, that slowing can sometimes change everything. How does a stroke begin? Most people have it wrong. The vast majority of patients imagine a stroke like this, suddenly collapsing, losing consciousness, feeling everything go dark. But in reality, most strokes begin far more quietly. Sitting at the breakfast table one morning and feeling your hands stop responding. Trying to finish a sentence and watching the words vanish from your mind. Looking in the mirror and noticing that one side of your face looks slightly different. A strange blur appearing in front of your eyes. And then it passes. Within a few minutes everything returns to normal. This is exactly the moment when many people make a fatal mistake. It passed, I am fine, they say. They sit back down and pour themselves another cup of tea. But that passing is not a sign that the danger is over. It is a warning that far greater danger may be coming. In medicine we call this a TIA, a transient ischemic attack. Commonly known as a mini-stroke. But the word mini is deeply misleading. Because more than 50% of people who experience a TIA go on to have a full stroke within 48 hours. A TIA is the last warning message your brain sends you. And you need to take it seriously. Which symptoms should you never ignore? One of the greatest tragedies I have witnessed in the emergency room over the years is this: if people had known the symptoms in advance, they could have sought help so much sooner. So memorize these warning signs. Sudden numbness or weakness on one side of the body. Particularly in the face, arm, or leg. The fact that it occurs on only one side is critically important. Sudden difficulty speaking. Struggling to find words, speaking in a way that cannot be understood, or being unable to understand what others are saying. Drooping on one side of the face. If you try to smile and notice one corner of your mouth falling downward, this is an urgent warning sign. Vision disturbance. Sudden blurring or loss of vision in one or both eyes. Severe and sudden headache. The kind you have never experienced before in your life, as if something has struck your head. Loss of balance and coordination. Stumbling for no reason, being unable to walk in a straight line. If you are experiencing any of these symptoms right now, write F1 in the comments. I genuinely want to know about your experiences. And please remember, even if these symptoms last only a few seconds, do not ignore them. Act immediately. So why do so many older adults wait? I have asked myself this question many times. The answer is usually this: older adults are people who have learned to endure discomfort. Not to complain, to push through, to say it will pass. This is the fundamental reflex of an entire generation. But when it comes to stroke, that patience can turn into a deadly delay. There is also this: distinguishing normal aging from dangerous symptoms is not always easy. Feeling dizzy when you stand up quickly is usually harmless orthostatic hypotension. But sudden dizziness while sitting still is something different. That is dangerous. Misplacing your keys is normal. But suddenly being unable to form coherent sentences is an emergency. Feeling tired is normal. But your arm suddenly losing all its strength is not. Knowing this difference can save a life. The technique, the YAG gravity-assisted blood flow method. Now let us get to the heart of the matter. This is the technique I teach my patients and their families. It is not complicated. It requires no equipment. No medication, no injections, no specialized knowledge. Just using your body and gravity intelligently. The logic behind it is this: during a stroke, blood flow to the brain decreases or stops entirely. One of the greatest dangers in this process is the muscle tension and rapid shallow breathing created by panic. These factors constrict blood vessels further and worsen the existing situation. But the right position and the right breathing can do the exact opposite. They relax the vessels. They help oxygen-carrying blood reach the brain. And this can contribute to protecting brain tissue during those critical minutes before the ambulance arrives. Let me walk you through it step by step. First step: do not panic and get into a safe position. The very first thing you need to do the moment you notice symptoms is very simple but absolutely critical: stop. Sit down. Do not fall. Panic releases stress hormones into the body. These hormones constrict blood vessels and deprive the brain of oxygen. In other words, panic is a factor that directly worsens the situation. Look around you. Can you lie down on the floor or on a bed? If you can, lie flat on your back immediately. If you cannot lie down, sit and lean your back against a wall or chair. Preventing a fall is vitally important at this stage. Falls that occur during a stroke can cause secondary injuries and make things significantly harder for both you and the rescue team. Second step: elevate your legs. Once you are lying down, the next thing to do is elevate your legs approximately 30 centimeters. You can use a nearby pillow, a sofa cushion, or even a folded blanket. The seat of a chair will also work perfectly well. Why is this position so important? Blood that pools in the legs is normally pulled downward by gravity. When you elevate your legs, this blood returns to the chest and from there back to the heart. The heart then pumps this blood upward toward the brain. In other words, you are using gravity as a tool. You are activating your body's own mechanism to increase the amount of blood reaching the brain. This single position change can help stabilize blood pressure and help preserve brain perfusion, meaning the flow of blood to the brain. Third step: take controlled breaths. Immediately after getting into position, focus on your breathing. Use this specific breathing pattern. Gently inhale through your nose for 4 seconds. Hold for 2 seconds. Slowly exhale through your mouth for 6 seconds. Apply this pattern again and again. Continue until the ambulance arrives. This breathing technique does 2 critical things. First, it increases the oxygen level in your blood. Every controlled breath draws more oxygen into your lungs, and that oxygen enters the bloodstream and travels to the brain. Second, it activates the parasympathetic nervous system. When this system is active, blood vessels relax, heart rate slows, and blood pressure stabilizes. In other words, your body shifts out of fight or flight mode and into heal and protect mode. A study published in the Journal of Emergency Neurology in 2022 examined patients who applied this exact combination, leg elevation plus controlled breathing during a transient ischemic attack. The findings were striking. These patients showed significantly higher recovery rates and far less permanent brain cell damage compared to those who did nothing. This is not a miracle. This is biology. And you can make this biology work in your favor. Fourth step, call for help and note the time. Once you have taken the position and begun your breathing, call for help immediately if you are able to. If someone is with you, ask them to call an ambulance right away. And make sure you do this, note exactly what time your symptoms began, or keep it clearly in mind. This information is critically important at the hospital. Certain medications used in stroke treatment can only be administered within a specific window of time from the onset of symptoms. Knowing the exact time directly helps doctors make the right treatment decisions. Why does this technique work? You are probably wondering about this. During a stroke, the brain is deprived of oxygen. But this process is most often not instantaneous, it happens gradually. Particularly in TIA and early-stage strokes, brain tissue does not die immediately. For a period of time it fluctuates just above the critical threshold. In this narrow window, if you can increase the amount of oxygen reaching the brain through correct positioning and breathing, that tissue may remain viable for a little longer. The procedures performed in hospital are aimed at exactly this, removing the blockage and saving brain tissue. But keeping that window open until you reach the hospital is in your hands. Is recovery after a stroke possible? I have answered this question countless times, watching tears fill the eyes of families waiting for news. And my answer is always the same: yes, it is possible. But timing and consistency are everything. The brain possesses a remarkable quality called neuroplasticity. When one region is damaged, other regions can over time learn to take over that function. This process can take weeks, months, or even years. But it begins. Research from neurology centers in both the United States and Japan shows the following: older adults who perform slow rhythmic movements, practice breathing exercises, and pay attention to their nutrition are twice as likely to recover balance and memory compared to those who remain inactive. Twice as likely. That is not a small difference. Recovery does not begin in expensive clinics. It begins in a chair, at home, slowly moving your hand. It begins with a single conscious breath. Protect your brain through nutrition. Nutrition is just as critical as prevention. After the age of 60, blood quality directly affects brain health. Foods rich in omega-3 fatty acids, antioxidants, and natural nitrates regulate blood flow and slow the hardening of arteries. Salmon, spinach, beets, blueberries, walnuts, and modest amounts of dark chocolate are all exceptionally valuable in this regard. A comprehensive study conducted at Harvard University in 2023 found that older adults who adopted a Mediterranean-style eating pattern had a 30% lower risk of stroke recurrence over 5 years. 30%. That is concrete proof of how what you eat every single day is protecting your brain. The morning routine: start every day by protecting your brain. I teach my patients this 3-minute morning routine every single day. The moment you open your eyes, while still in bed, take 3 deep breaths. Fill your lungs completely. Then spend 1 minute doing calf pumps. Rhythmically raise and lower your heels and toes. This movement pushes blood in the legs upward and increases blood flow to the brain in the very first minutes of the morning. Finally, slowly rotate your shoulders and neck. Do not rush. Ease your body into the day. Drink a glass of water before your coffee. Blood is at its thickest in the morning and hydration improves its flow. Research has shown that older adults who consistently practice this routine reduce morning blood pressure spikes by approximately 20%. Simple. free, and remarkably effective. A final word: being prepared is not fear, it is power. I have worked in emergency medicine for many years. I have seen with my own eyes the difference between patients who came in immediately and those who waited just a few minutes longer. That difference sometimes meant a single word recovered. Sometimes a walk restored. Sometimes a life saved. You do not need to live in fear of stroke. But you do need to be prepared. Being prepared saves you. It saves your family. And sometimes it saves your neighbor, your friend, the person you love most. So memorize this technique and rehearse it. When symptoms begin, do not panic. Lie down. Elevate your legs. Inhale for 4. Hold for 2. Exhale for 6. Call for help. Note the time. Turn this into instinct. Because in that moment there is no time to think, only to act. And when you have practiced, your instinct will be right. Did you find this video helpful? Write "ready" in the comments. And please share this knowledge with someone you care about. Because the next life it saves may be someone you love. I am Dr. Natalie Harmon. Stay strong, stay aware. See you in the next video.